Mutations in ASXL1, EZH2, B-Core, STAG2, and mutations in the spliceosome complex are seen in people with AML with myelodysplasia-related features, and this is traditionally a group that faces adverse prognosis. We sought in our analysis to determine whether mutation dynamics in these myelodysplasia-related mutations can have any correlation with prognostic outcomes in people with newly diagnosed AML with myelodysplasia-related mutations. So what we did was we retrospectively analyzed 185 patients who were treated with low-intensity therapy, especially with venetoclax at MD Anderson Cancer Center from 2017 to 2025, and looked at their myelodysplasia-related mutations at baseline and at best response. And what we found was that in these people, 26% of patients were able to clear their myelodysplasia-related mutations, and 74% of them had persistent mutations at best response. And interestingly, in these people who cleared them, especially in people who had negative flow cytometry at best response, there was a superior overall survival and relapse-free survival in people who were myelodysplasia-related mutation negative. And again, especially in people who were flow cytometry negative. This did hold up in multivariate analysis, and people who had persistent myelodysplasia-related mutations actually had an inferior overall survival. They had a hazard ratio of 1.7. And the take-home message of this analysis is that dynamics of myelodysplasia-related mutations may provide prognostic information beyond the negative flow cytometry and could identify a high-risk population that might otherwise be missed with a negative flow cytometry result. So based on these results, people who have negative myelodysplasia-related mutations, persistent myelodysplasia-related mutations at best response and their inferior overall survival outcomes in this analysis, one might infer that they have a greater likelihood to have a decreased overall survival, and this could change your decision to go forward with like a transplant or your maintenance therapy duration or perhaps your strategy. But of course, further analysis is needed to see whether this holds up prospectively.